Resources Protection specifically, but I'm also blessed to serve the tribe on our Health Authority Board and on the Natural Resources Committee. To introduce my family, my mother is Peggy Mahoney, my father is Pete Mahoney, my mother's mother was Marlene Means, and my father's mother was Edith Zachary. And I'm here to talk to you guys today a little bit about caring for tribal patients. It's a really complicated thing, I think, as many of you who work with tribal members or Indigenous peoples might know. So we're not going to get too far into the weeds here today, but I'm hoping to provide you with some unique perspectives that might make your job a little easier in that facet. So next slide, please. So here are some things I want you to think about as we go through this presentation. How history has impacted the current health issues that Indigenous peoples face. I want you to be open to rethinking the definition of what a health history actually is. And we're going to get into that in reference to historical trauma and how that can affect health issues that Indigenous people face today. Effectively treating Native American patients requires not just knowing the health history of the patient themselves, but also the history of the tribe that individual belongs to, federal Native American policy, historical trauma, and as much as you can know about that person's family. Every tribe and village and clan had its own unique culture and history, and no two are identical. Keep an open mind to different worldviews and the way different peoples might experience medical care. And then I throw here at the bottom, I know that I do know nothing. And that's a quote from Socrates. And it's just about keeping an open mind and not getting closed in, thinking you know all there is to know. Next slide. So some numbers to think about when it comes to Native Americans. There are 574 federally recognized tribes in the United States, here in the lower 48 and some up in Alaska. That doesn't count the number of tribes that are recognized at the state level but don't have federal recognition. Currently, there are 326 different Indian land areas that are administered as reservations, but these numbers don't accurately represent how diverse cultures are among Native American tribes. For example, within the Coeur d'Alene tribe, there were multiple clans that lived along the St. Joe River, the Spokane River, the Coeur d'Alene River, up on the Pend d'Oreille Lake system. Each one of those different clans within the Coeur d'Alene tribe would have had their own stories, different ways to say different words. They would have used different materials to build canoes. And so cultures can be extremely diverse even within the same tribe of people. Next slide. Here's a map of the Aboriginal homeland of the Coeur d'Alene tribe. And so we have the reservation here today in that gray shaded area right around Plummer. It's 345,000 acres, but historically we had over 5 million acres in our territory. As you can see, it covers a really diverse range from Cheney over in the west to St. Regis in the east, down towards the Snake River on the south, and then north up into the Lake Pend d'Oreille area. So that was a really wide area that we traveled. There were a lot of different foods available within that area that we traveled to during various parts of the year. And like I mentioned before, we had different clans located in different areas, and they would have relied on different foods during different portions of the year than other clans in the Coeur d'Alene tribe. So just an extremely culturally diverse people. Next slide. So what is culture? Culture is the subconscious programming of the mind. I have my cultural iceberg here on the right. And, you know, just like an iceberg, culture is the same way. You only see the 10% that's above the surface. So you see artifacts, historical individuals, the way people behave, their traditions, the way they dress. But then underneath that visible line, we see the invisible parts of culture that we don't see unless we're a part of that culture. So we have the way people view the world, assumptions, religious beliefs, attitudes, perceptions, and values. Assumptions, attitudes, and perceptions, I think, can really be applied to the way Native Americans or Indigenous people view the medical system and medical care. And then cultures evolve and change over time. They're not set in stone. They're going to change as the different peoples who use them need them to change. Next slide. And then we have different types of culture. So we have historic culture, which would have been the way the Coeur d'Alene tribe conducted themselves hundreds of years ago, pre-contact with colonists. We have our modern culture, which is the way we act today, the things that are important to us today, our worldviews of today. There's this concept of pan-Indian culture, um, which for those of you who may not be familiar with how diverse Native American tribes are, it's just this idea that all Native Americans speak the same language, do the same things, have the same historical stories, and that's just not the truth. Like I mentioned before, there's hundreds and hundreds of different Native American tribes, and so pan-Indian culture, it really isn't a thing. And then we have clan, band, family specific culture. That's like what I was talking about before, how the Coeur d'Alene tribe had different families located on various river systems. Those different families would have told stories in different ways. They would have hunted or gathered different foods, or maybe they'd focus more on fish than they would on wild game. So extremely diverse. Next slide. One of the main issues that Indigenous peoples or tribal people might have is access to care. No two tribal healthcare systems are identical, and different tribes offer different services. So here on the Coeur d'Alene Reservation, we're really blessed to have Mariman Health, and Mariman is able to offer medical care, dental care, optical, chiropractic, behavioral health. We have some really awesome preventative care facilities like our Wellness Center and our Core Center, which is our youth center. And not all tribes are as blessed as we are to have a system that can offer that many different types of services. The majority of IHS or Indian Health Service facilities are located on reservations or rural areas, but that can cause issues too because 78% of Native Americans live in cities or urban communities. And so they may not have as good access to care in some cases as people who live on the reservation, like here on the Coeur d'Alene Reservation. Next slide. Other issues that affect the health of Indigenous communities, like I mentioned, access to care, lack of capacity. So even if a tribe wants to offer all these different great services to help their people have a better quality of life and a better healthcare system, they might lack the capacity to offer those. They might not have the buildings to house them. They might not have a healthcare system to organize those types of things. Native Americans face a lot of issues with poverty, unemployment, a lack of access to healthy foods. Some Native American communities might be in food deserts where it's a lot harder to get access to healthy fruits and vegetables or things that aren't processed and made to last for a long time on the shelf. And then historical trauma. Historical trauma is another really big issue that affects Indigenous communities all over the world. And we see it a lot in every single Native American community here in our nation as well. Next slide. So what is historical trauma? So it's the effects that trauma is inflicted on a group of people because of their race, creed, and ethnicity, and this lingers on the souls of their descendants. It may result in people in these communities experiencing higher rates of mental and physical illness, substance abuse, erosion of families and community structures, and it's a cycle of trauma that can destroy families and communities and threaten cultures themselves. So historical trauma is not about what happened in the past, it's about what's still happening today. So these really horrible traumatic events that our ancestors lived through, that changed the way they interacted with people in their everyday lives. And so that's how that trauma keeps, it gets reduplicated into the next generation and the next generation after that. Next slide. So how do these issues manifest, these historical trauma type issues? And then other issues that Native Americans face, like a lack of access to healthy foods. It can cause high rates of diabetes and other chronic illnesses, a really high rate of obesity. 38% of Native Americans struggle with obesity, drug and alcohol abuse issues, behavioral health issues, a much higher rate of suicide. Suicide is actually the second leading cause of death for Native Americans between the ages of 13 and 26. A seeded distrust of the government, and that includes the healthcare system. My infographic over here shows that 1.2% of the population identifies as Native American or Alaska Native, and over 21% of those people had a diagnosable mental illness. And I think this came from 2018. Next slide. So what can be done? Culture is prevention. Culture, there's been some studies on First Nations peoples up in Canada, and they found that tribal communities that had more cultural factors that are alive and active in their community, like speaking their language, eating traditional foods, traditional dance, songs, those communities that had a lot more cultural activities had lower rates of suicide, depression, substance abuse, and alcohol abuse. As a provider, you can build relationships with these patients and maybe understand a little bit better about their background. Just because you're serving a Native American patient up in the North Idaho area does not mean that patient is Coeur d'Alene. They may have come from a different area of the country, and their families and tribes would have experienced different historical traumas than the Coeur d'Alene tribe did. Look through a different lens, just meaning, be open to that patient's perspectives, and then do your homework. As much as you can learn about like the history of Native American peoples and dealing with the government and healthcare systems, the better prepared you'll be to offer that patient, proper medical care. Maybe have a better understanding of what their historical traumas might have been and how those are affecting the way that patient lives their life and their quality of life today. Next slide. These are just some of my resources. Crystal, you can send this out to anyone who's interested in maybe going through the presentation at a different time. Next slide. And then this is just my contact information. I know there's a lot of information that came out in this presentation, and we probably won't have enough time to really get into it today. I don't know if there's going to be a question and answer period or not. But you guys can feel free to contact me at that phone number or at that email address if you have any other questions or want to connect for a one-on-one or get more information about the topics I went over today.
Perfect. Thank you, Peter. If you want to put questions in the chat box as we go, we will have a Q&A at the end. And so we'll kind of move on to our next presenter now, and then we'll do questions at the end. So I'd like to pass it on to Dee Jansen as I get out of these slides, and she's going to give us a little bit about kind of the patient experience around caring for tribal patients. So welcome, Dee.
How to unmute, I guess, so you can hear me, right?
Yes.
Okay, so I probably should give you a little bit of background about me. I have been here at Mariman Health, formerly known as the Benowa Medical Center, for 24 years. Had several different titles and roles here, but most recently the patient experience manager, which is overseeing our front desk, which is you come in, you see us first and foremost. I was a patient advocate and still act as a patient advocate on several levels, and then I'm also part of the patient and family advocacy committee up there at Kootenai Health. I am a mother of 3 tribal members, all grown. I have been a part of watching all the different cultures, as Peter was talking, that every part of a family is different. I have watched some parts of the family that I was with do like something called a jump dance, which a lot of people don't understand, but that is their spiritual praying for the season type of thing. And then there is the other side, which is like they do stick game, they drum, they dance, they sing. That was a part of my group. Watching how different even inside of this family was, how part of it would do one way and the other part would do another, was different for me to see. My children all do different things as well. My daughter is a gatherer. She is always going out to do the root digging, berry picking. She is not a hunter. She doesn't do any of that, but she does do the sewing, does the ribbon shirts and things for ceremonials. My son, well, both my sons actually do drum and sing. And then I do have one that does a lot of dance. So they're all different in their own ways. The one thing I did learn about that I do learn on a constant basis with our patient population is trust. Trust is huge. If they don't trust you, they don't talk to you. If they're not comfortable, they don't want to talk about their health history over and over and over again. They save the juiciest pieces for their provider that comes into the room. They don't want to tell the nurse. They don't want to tell the front desk. They want to be able to have a conversation with their provider. It's personal for them, and it takes a lot to get through that. And so with our providers here at Mariman Health, the longevity, they become friends, they become family. And so when they leave, it takes a lot to get that trust back with our tribal people. They all have different traditions. There are some that still do go to healers. They don't want to do modern medicine. And as much as it's all grown, the science behind it, they are more trusting of their own healers, their own medicines, whether it be the herbs they're gathering, the people they talk to. They would trust that before they come to a facility they don't know. And I think that's where trying to build that gap between our little part of the world here that they trust and having to go outside of that trusting world to a facility like Kootenai Health is really difficult for them because there's so many people coming in and out of the room and they don't know what each role is. And it's very disheartening to them that they have to keep repeating themselves to the point where they almost act as they're shutting down. Instead of helping you help them, they feel like you're intruding. And so helping them feel comfortable so they can trust you might take some time because of what Peter had talked about, that historical trauma. There were times when you would hear our tribal people say, don't send me to a specific hospital because we never come out. We don't come back. And that is then passed on from generation to generation. Don't take me to Benoit Community or Kootenai Health or Sacred Heart, or they would always throw out a hospital because they felt that there was a stigma there. There was bad juju there, that they didn't want to go and lose their people. So me being what I do here, I've built a lot of trust with, I've lived here my whole entire life. I spent half of it here at Mariman Health. People know that they can come to me and I will help them find a ease and flow on who they can talk to get their issues taken care of. And even outside of here, I mean, I reach out to several of Kootenai Health staff when we're having patient issues that they feel like something wasn't done right, or they feel family is huge, where a whole family could show up in your waiting room if somebody is there, because that is how they are. They take care of their own. And so if they show up and then they have to follow the rules, it's hard for them to understand why your rules trump their belief. And I think that's a lot of the gap right now between facilities, is that our people take care of their own and they get there and they're told that they can't. And so they may sit out in your parking lot for days if they have to take care of their people, whether it be by praying and singing, drumming, smudging. There are all different ways that they do that. I'm not sure what else I can actually talk about other than getting them to trust you. is huge.
Thanks for that insight, Dee. Do you have maybe a exact patient case that maybe didn't go so well recently that you could kind of tell us about, and maybe ways we could have done a teeny bit better?
Well, I think the hardest part is because of this pandemic that we're all going through, is we have patients that go to you and need more care. And when the big machines come in and the ventilators come in, the family that you are able to go in have that you can only be there for 24 hours and then you have to wait. Those protocols are probably what are really frustrating a lot of our patients from our area. So COVID is huge. COVID protocols are big, and I'm not sure that there could have been anything different because they're just trying to keep everybody safe. But trying to keep the family informed is probably the hardest part.
So yeah, what I'm hearing you say is in working in local tribal patients, maybe communicating with the family or outreach even more has more significance.
When people call, because you have these families are big, and I understand that, and it's very overwhelming to healthcare systems when you have several different family members calling, trying to find out what's going on with their loved one. But there are sometimes when the family dynamic is kind of broken and there's one person from this part that you could talk to, but then that person's not talking to the rest of the family. So you're going to start getting several different phone calls. And if you don't have all of those people on your list, you're not going to talk to them. And that makes it very hard. And that's what frustrates a lot of our patient families.
Thanks, Dee. We have some pertinent questions in the chat box related just to this. So I'm going to ask Dr. Peterson to ask you a couple questions if you don't mind.
Sure.
Hi. See, sorry. Can you hear me? Okay, great. So I have a couple of questions from the chat. One is, do you have any ideas for developing a relationship with patients with a very limited time commitment? So, so there's a very brief interaction window, such as a patient that comes in for an endoscopy, any tips for quickly establishing a relationship with a patient and garnering their trust?
First and foremost, probably when you come into a room with them, is to not have the pen and paper or the pad, but actually come in and talk to them like you're gonna go visit them in their home. Because they see pen and pad, or they see your tablet, or they see you sitting at a computer, they feel like you're not listening to them.
So eye contact, face-to-face conversation, very important.
But don't be offended if they don't look you in the eye, because it's
Okay.
still you're earning their trust.
Okay. Okay. That's very good information. So the most important thing, what I'm hearing is the most important thing in the relationship is that we, as providers, earn their trust. So we are asking for them to trust us.
Yes.
Okay. Another question, this was actually one that I had. What is the relationship between the healers that the tribal members are using and Mariman Health? Are you familiar with the local healers in the area? Is there a good relationship, or is that something that they're completely outside of the medical community?
It's completely outside of the medical community. Healers are somebody in their family from traditions past. It could be, as a young child, your grandfather went to someone, and there's somebody in a family that they go to seek out their help. That's when they tell them their most personal matters. You know, they don't want to tell everybody that. And that's one of the things that I had one of my patients tell me. She's an elder in our community, and she said having an audience of 2 or 3 people in a room is traumatic. It's not dramatic, it's traumatic because out of all of the years, and I even have this written down, holding and guarding private matters was one of the first things that was taught to you from childhood. There's some personal self that you did not openly discuss at random. Sorry, my phone, sorry. And it was strictly taboo. You only went to a very respected individual you knew and trusted to help you through your crisis. So that says a lot when modern medicine came around and they're trying to tell you you have to talk to somebody. When you used to go to somebody's home, you sit in sweat lodge, or you had a very intimate time with them and you talked it out with just one individual. Now it feels like you're speaking to several different people, from the front desk to your nursing staff to the doctor that finally comes in to a lab tech to a x-ray tech, whatever it may be, to do your wraparound. That healers are not connected in the medical field in any way. It's their spiritual leader. That's where they go. It has to be pretty bad if they're coming to the medical center normally. If it feels like their healer can't help them, or their roots, or they drink tea to help with the sore throat. They chew on husk, and and Peter could probably say a lot to this too. Their traditional foods and herbs that they do, if they don't work, that's when they're seeing the doctor.
What types, or do you know what types of herbs are most commonly used?
I think Peter could probably talk more to that. Is he still
Okay.
with us?
There was another question in the chat. Where's the best place to go to get the research on tribal culture? I think Peter had mentioned that that we definitely should be researching the population and understanding their culture prior to our interactions. Where's the best place to go to learn more?
So, I'm sorry if that was kind of confusing or if I misrepresented it. I think when I said do your homework, what I meant more was do research about that tribe's history. Sometimes it can be hard to do research about a culture because then, I think the only way to really research a culture or get more insight on it is to have face-to-face interactions with those people and ask questions about their worldviews and their viewpoints. But when I was talking about doing your homework, I meant do your research on that individual tribe's history, and that might give you better insight on how to treat that patient. I guess one example would be there's a tribe in the Southwest in the 70s, and they wanted some blood work done on tribal members to find out why they were seeing a really high rate of obesity. And so this tribe agreed with, I think it was Arizona State University, to have this blood work done. And then about 15 years later, they find out that the blood work samples they gave were being used in genetic studies that were trying to identify mental health issues on the genetic level. And so that tribe, they were really taken advantage of in that way by that institution, by those people working in that specific medical facility, and that caused a lot of distrust between them and medical communities at large. Some tribes may have instances like that and some may not. So it's just really important to know as much as you can about the history of the tribe that individual belongs to.
Another question from the chat from Dr. Carol in Pediatrics. They do family-centered rounds in pediatrics, and this includes the entire care team at the bedside. And it seems that approach would not be well received by tribal members. Is that something that they should avoid doing in the future or even asking about?
I think that might be a question for Dee.
In my opinion, most families, if you ask first before you bring in a whole entourage of people, it's more accepted than just coming in. it really depends on the situation too. I mean, if you've got a high risk type of situation going on and you're bringing in 6 different people to talk about the lab work, the x-rays, the next steps, that, you know, too much information is going to confuse the waters a little bit, and they're going to want to be able to focus on what is the most important that needs to be done right now. Peter, did you want to answer the questions about the herbs and things that are collected? What's the most popular, do you think?
I think you mentioned khaskhas as being one. I think that's the main one that my family talks about. And then there's things like uh, smukweshen, which is it's like a type of sunflower, but you can dig that up and you can eat the stems off of it for like a mild pain reliever. You can take the roots and boil that to make a tea. Those are the two that I'm aware of.
And what did they do with the camas? Camas is
So
big.
yeah, so camas is I don't know if it's medicinal uses, but it was a traditional food. It's like a little root, but you dig it up and then you have to bake it in the ground for um, I think it's up to 36 hours sometimes to get those sugars to really break down so your body can digest it. I've heard of people, and this is anecdotal. There's no medical research I can find of, but I've heard of members of local tribes switching over to camas when they became diabetic as a way to get carbohydrates into their body and not having as bad of an insulin response.
Thank you. That's all the questions we have right now. Dr. Pyrak has a handout to share. Sorry, we're struggling with being in the same room.
All right, everyone, I just wanted to go over, tell a little bit of an experience that I've had working with tribal patients. Admittedly, I am not tribal, and so anything I kind of say today, I also ask Peter and Dee to weigh in on kind of their perspective as well. But for those that joined late, I'm Dr. Crystal Pyrak. I'm current faculty at the Coeur d'Alene residency here, where we train family doctors. My experience working with tribal populations is kind of multifaceted. I currently work at Mariman Health and employed by the Coeur d'Alene tribe part-time. I also worked with the Maori population for a year and a half in New Zealand, and I grew up on a reservation in northern Montana. And I just want to share a story because when I first started in Coeur d'Alene, I was overly confident and I was the attending physician on our residency service, so I was overseeing overseeing kind of resident care. We had a tribal patient admitted to our service who I actually knew. I had cared for her at Mariman down in Plummer, Idaho, and because I knew her, I just felt like I needed to spend more time with her or something. And each day I'd let the team kind of talk to her about her medical issues. And then I'd ask her about her family. And sometimes I'd go back and spend a little bit more time with her. And our conversations were very jokey and full of stories. And about the 4th day of her in the hospital, she asked me not to care for her in the hospital anymore. And I couldn't believe it because all of our interactions were so positive. And I had learned later that she felt I was not taking her medical care seriously. I had a bias because of my relationship to the Mariman Health Clinic, and I basically had not taken her medical condition seriously and really helped her through her care in the hospital. And I think it's a good reflection of kind of bringing our own biases to these conversations and recognizing where we're coming from. And what I want to leave you all today with is a lot of the same communication efforts that work with regular patients that result in good care can be applied to caring for Native patients or Indigenous or tribal. A first tip is also ask what the patient wants to be referred to, which word or identifying term is appropriate for them. But ultimately, what a lot of the communication techniques we use for patients that result in good care can be applied to American Indians. Listening to patients, not being rushed, taking their health issues and concerns seriously, but also not thinking what's right for one individual or one group is right for all of them. You can get yourself into a lot of trouble. Me thinking by spending a lot of time with a patient and knowing her family is what's going to result in good care for her and what she needs and wants was not right at that time. So I pulled a little bit of a handout here that we can pass on for those that want it. It was developed by the University of Washington School of Medicine in 2018, well, initially in 2016 and then edited in 2018. That just talks a little bit about tips of working with American Indians or the Alaska Native population. And so I just thought I'd kind of hit on a couple of their topics here, just for some comments of where you might get in trouble and kind of how to think about this. And just remembering open communication, listening and important, and not what's right for one person is going to be right for everybody. So kind of how does an American Indian or Alaska Native patient perceive illness? It's already been touched on by Dee and Peter, but there's a big sense of kind of the holistic approach to patient care. So it's not just the acute medical issue, what's going on, but also spiritual views, mental health, emotional health, what's going on in the family and their life that is really important. And so whenever I'm admitting a tribal patient, I kind of always include in my initial admission, what else is important in your healthcare today? Are there any spiritual beliefs that I need to be aware of, that I need to know about? How have you been doing from a mental health standpoint? How is your family? And if there's trust there, sometimes I will get that information, but not always. But it's always something that I kind of touch on a daily basis to make sure that we're approaching not just the acute medical issue, but the importance of the holistic view. We've also talked a little bit about traditional healing practices. I usually ask patients openly, are there any traditional healing practices that you have that we should be aware of? Is there a healer you would like us to communicate with? And it's okay if you don't know how to ask it appropriately or you don't know the appropriate terms. Most patients just like to be asked that we're thinking about traditional healers or that they might have other practices. There's this idea that time is perceived differently in some tribal communities, and so flexibility around scheduling is important. How you prescribe medications and tying that to other aspects of the day, sunrise, sunset, meal times could be important for certain patients. So just being mindful of that and asking about it. The concept of family is incredibly important, like Dee hit on today, and Peter. Usually major decisions about healthcare are made in a family setting. Sometimes there's actually a point person in a family for medical decisions. And so making sure all the important individuals are there when you have family meetings, and asking the patient if there's an individual in their family who is primary medical decision maker can be really important. And, you know, informed consent, just making sure you're communicating everything with patients. And also family members sometimes can be important in those discussions as well. And then some other things about kind of how we reduce communication barriers, nonverbal communication. I've heard Peter talk before, and he expresses a lot about how some older tribal patients will communicate in story. And sometimes you'll ask a tribal patient a question and they'll start a story. And if you're rushed or you're in a hurry, you're going to miss the entire response or what the patient's getting at. And so making sure you take time and you listen to the stories, and you'll be surprised at what information you learn about the patient and the culture. Yeah, so trust, we've already talked about, you know, they might not make eye contact with you at first if they're not sure they can trust you. Always, as we should with every patient, warning them before we touch. Is it okay if I touch your head? Is it okay if I touch your hands? Some cultures, the head is sacred, and starting kind of top down on an exam could be very uncomfortable for some patients, or outright offensive. So just explaining what you're doing and why you're doing it. And yeah, just if they're wearing certain jewelry or something special, it may be more to them than just a piece of jewelry. And if you're asking to remove it for a procedure, making sure the patients are okay with it, or family members are there to take it if absolutely necessary. Those are some kind of basic areas you can get in trouble. So I'm going to stop there since we only have 15 minutes left. And I'll ask first if Peter or Dee want to comment on anything I said. Otherwise, I will pass it back over to Emily to ask the rest of questions. So Peter, yeah, any comment there, or Dee? Doesn't look like it.
I have just one thing to say. When you're talking with the patients, probably how, you know, we all in the moment think of healthcare and the big words and they will shut down if they don't understand what you're talking about. And just kind of reiterating back, do you know what I said to you? Do you understand what I'm trying to tell you today? Things like that. Not talking down to them, but making sure that they understand what decisions are being made in their healthcare without using the medical words. I don't know if that makes sense to you.
Yeah, thanks, Dee. You hit on like another topic that's important for patient communication. We use the term not using medical jargon. So in basic English, we have to remember we know a lot of words that a lot of patients don't. And so making sure we're applying that to all patients, and specifically with tribal patients, definitely. So I'll pass it back over to Emily if you have some further questions to answer.
I haven't received any additional questions in the chat. I did want to.
Can't hear you.
Emily, we lost your audio.
Did anybody hear any of that? Sorry.
No.
So hopefully you can hear me now. So a link to this document that Dr. Pyrak just shared is available, will be available in the chat, and is available on the cloud if you'd like to access it and print it off for your own use. Also, this session was recorded, and a recording will be available on the cloud under the medical staff services page, as well as other recordings from the Inclusive Care Lecture Series. So Thank you so much, Dee and Peter and everyone who's joined us. We had a great turnout today. I think people are really wanting to learn and wanting to do better with this very important population in our community. Thank you.
Thank you.
So I think that's it for our presentation today. If there's any follow-up questions, I have contacts for Dee and Peter, and my email is also cpyrac@kh.org. Any staff at Kootenai could always try to get a hold of me or pass that on, and I can get the questions to Dee and Peter as well. Thank you so much, and have a wonderful Tuesday, everyone. Bye-bye.